Okay, hello everyone. This is Dr. Wen. I'm a dentist for 22 years doing dentistry. I want to share with you 10 essential things you need to know if you want to become a good dentist. This is the topic for student, dental student, or pre-dentist dental student, undergraduate student who figure out decision to make whether you want to go for dentistry and you worry if it's a good idea to be doing dentistry. But in dentistry, there is also seven different subspecialty. A general dentist, an endodontist is a specialized in root canal. An orthodontist is the doctor doing braces straight your teeth out. A prosthodontist is the one that do denture and cosmetics, full mouth reconstruction. And then you have the uh, oral surgeon who is removing your wisdom tooth and fix your broken jaw. And then you have the uh, a little bit more academia, also a pediatric dentist who take specialize in taking care of kid. That's seven, right? And then you have an additional one we call two other additional one called dental pathologist or oral pathologist. Dentists are specialized in disease in the mouth. And then you have also dental radiologists specialize in interpretate X-ray. And then you also have another one is called the dental anesthesiologist who actually take care uh, your uh, uh, put people asleep and uh, allow the dentist to do um, extraction or complicate dental procedure that take a long time, or whether the patient is really nervous and require to be put in sleep so we can do dentistry. That's just roughly the idea of having uh, uh, a different field. So before we jump into those 10 essential requirements to be a good doctor, dentist, I'm going to talk a little bit about the economy of the this year along. Um, this year along, according to the Health Policy Institute and the American Dental Society Association, most dentists are skeptical about the confidence of U.S. economy. But among those who are confident, the main reason, the top 10 reason they are confident is the current administration. They believe in the current administration. They believe in U.S. economy re, uh, resiliencies. And then thirdly, they believe in the current trade, tariffs, tax policy. Then the fourth thing, they believe in the stable, improving economy of indicator. Um, and the last thing is strong patient demand. There's a lot of strong patient demand. Now, for those painters that are saying confident, this is what they say. Some of them say, I do think that inflation have leveled out, and I'm so busy, I may have to turn my patient away. The dentists that doing really well say that we are a consumer driven economy and have been for many generations that will not change. People will crumble about prices, make short term adjustments, but continue to spend. And then the other dentist would say, I believe the current economic changes will eventually lead to a healthier economy after initial hardships. And then one other dentist would say that really confident say, I think the current administration is making wise plan to help strengthen our country and improve trade with other country. This is a little bit of information about it. Out of the topic, I just want to jump in just to give you a little bit information about what dentist thinking about it. Just look at the inflation that you can see in this graph. That the inflation indicate that a lot of reimbursement from the dental insurance cannot catch up with the inflation. This is something that you may not need to know at the dental student, but by the time you graduate, you would have to be aware that inflation is a big problem for your compensation. Anyway, my goal today is not talking about that. I'm talking about how to be a practical, a professional, and patient focused dentist, but be doing a good job. So the first thing I want to talk is you, in order for you to be a good dentist, you must have this strong foundation in science. This is a requirement. You cannot major in something non-science and you want to be a dentist because the dental school will require you to take the biology, chemistry, anatomy, physiology, microbiology. And in order for you to have a dental knowledge beyond these subjects and solid foundation that is crucial for your dental patient and diagnosis and treatment. Second thing is you have to have the manual dexterity and fine motor skill. If your hand is very shaky, very clumsy, we are afraid that you cannot be a good dentist. This is just the facts. In order for you to be a good dentist, dental field, you must have the good hand skill, eyes hand coordination. That's requirement. And so dentistry prescribe very precision and the practice of hand-eyes coordination and stability and steady hand is so important. Skill like carving, suturing, handling instrument accurately is so essential. Third one is continue learning key is the key. After you graduate from dental school, you still have to have the lifetime commitment that you will continue learn every year. So that's where you can have update technology, update technique, update dental material. And in order to do that, you go to workshop, read journal, and also come to the whether local or international or national um, annual event so you can get some update. Very important. You can also learn from your friend, your college. That's why you got to get the network friend. Number four, patient communication and empathy. If you don't have the ability to communicate among friends, um, mm, in undergraduate, how then it's going to be very hard for you to go to graduate and then able to get the patient, talk to them, mm, want them to come back so you can treat them. Um, so patient communication and ability to have an empathy um, way of taking care of your patient very critical. You must have this skill. This is requirement to be a good dentist. You can't communicate. You can't be doing big case. You're gonna run into major problem with your patient. You must learn how to communicate with your friend, with your family, with your patient. Learn. Number five, attention to detail. If you are the person that you cannot see the detail, I'm afraid that this dentistry is not for you. Um, very small mistake can cause a major consequence for your patient. Every detail dentistry require very meticulous. We're talking about micro millimeter. So you gotta really have to be able to have steady hand, good hand eye coordination, science, and then Now it comes to attention to detail. That's what you need. Every little detail is count. It's very important. You have to have the sixth thing is the problem solving and critical thinking. Um, Critical thinking include solution, rationality, judgment, decision making, facts, and then analysis and self corrective, and so it require a lot, and it does require you to have ability to give your patient three or four different options to. So any situation, dental situation, you have to present to your patient, and you give them option, especially in the restorative treatment. Uh, here's a seventh thing: is you gotta be active, ethical, professional, and that's required. Uh, that means that you put your prioritize patient welfare, honesty, and integrity first. Understand consent and confidentiality and dental boundary. You must have this professionalism and ethical mindset. You cannot be a good dentist if you lie to your patient, if you cheated on your patient. Number eight, stress management and patient. You have to learn how to balance out your mind, your body when there is a stress level. Consider complicated case, difficult patient, difficult staff. You must have the ability to balance out your stress. That involve routine therapy, music, spa, exercise, hobby, um, yoga, and so these are the requirements that you just have to balance it out. And very important for this number eight, stress management and patient ability to be patient to your patient or patient to you, because there's some material that you work with, it requires time in for setting, and if you do complex orthodontist treatment require time to finish the case. You do difficult surgical extraction or root canal, it requires time for you to finish a job. Teamwork and collaboration. A good doctor, good dentist is the one someone able to rehearse your complex case with your teammate, with your car, with your whether your specialist friend or with the employee in the clinic. So everybody aware of what you expect to finish in the day that the with the difficult procedure. And so, lastly, is the passion. That you gotta have passion in dentistry, and also not only that, you have passion, but people don't have money. Then you have to have compassion, and compassion is really important, because you can you can make yourself feel successful, but if your patients are not satisfied, whether you don't treat them well professionally or anything, then you lose your success. Success is based on how how your patient feel about you. So again, these are 10 essential um, recommendations to be a good dentist. I'm going to share one more tip, and that is another extra 10 thing that it would help you to be a better dentist. Number 11 is that you gotta learn to have a strong diagnosis skill that's required. What X-ray, early detection, and also you gotta have the mentor to teach you this. And then master time management. A good dentist, productive dentist require time management. So you need to practice that time management at you are in undergraduate school. Manage your time, balance out. And then the 13th thing is embrace new technology every year. Like I said, every year, new technology coming out. The dentists have to be um, receiving update update and latest uh, information so they can serve the patient better. So, and then number four is focus on prevention, not just treatment. Educate patient on oral hygiene, lifestyle habit. Uh, a great dentist empower patient to prevent problem. So you got to teach the patient. I've been doing dentistry for 22 years. I know each of patient have different uh, ability or IQ to receive the information. So you got to um, listen to your patient and hear and see how you understand about this person, particularly when you present the information. Not everybody understand what you're talking about. Very important. So you build caring for reputation. That's number 17. And caring reputation means that if you care for your patient, you gotta do everything you can to care for them. So you see that's a genuine love. It's not faking love. Number 16 is maintain ergonomic, ergonomic and health. Ergonomic is a position how you sit every day. It can hurt you or it can sustain you for a long time doing dentistry. So practice posture, eyes, hand, and a healthy dentist mean a longer, healthier career, right? So number 17 is learn business and leadership. You have to have business mind and leadership skill to sustain your private practice. Otherwise, it's very difficult. Number 18, humble and open to feedback. You gotta listen to your patient, to your staff. There's complaining. It's not that they hate you, just that they want you to know what you need to improve on. So ready to be receiving the criticism is important. Lastly, number nine is volunteer or serve outdoor outreach. The more you do charity search, the more you're gonna feel more professional certified. According to what I've been doing every year, I know that whenever I do more charity, I feel very at peace with my soul. Again, last thing, keep faith and compassion at the core. Without faith and compassion, you cannot work and feel great about dentistry. This is the reason why I love what I do, and I have time to share with you guys what I know. So, if you have any question, I'm a dentist for 22 years. I would love to share you everything you need to know. Thank you for watching. Have a great day. Bye bye.